My name's Kristin Ellis. I'm an occupational therapist with Interim HealthCare. I've been working with Interim for 5 years now, specifically working in assisted living facilities in upstate. When I was a teenager, my grandfather had a pretty massive heart attack and ended up having a triple bypass surgery, and this was in, the mid 90s, and he came home and he was terribly debilitated and did not feel well. He couldn't move around the house at all, and I had spent a few days on summer break caring for him, and in my heart, my head, I just thought something's got to be better than this. There has to be a better way to recuperate at home. And so from there, I decided to pursue therapy and knew that the more holistic, organic approaches of occupational therapy were much more aligned with my personality and my belief system. For me personally, a typical day, I do a good bit of reassessment visits. So the majority of my day is spent educating patients and caregivers in facilities. I do a good bit of standardized testing, lots of education and communication regarding pressure relief, mitigating issues with bladder issues, lots of balance training and falls prevention. Addressing the holistic approaches of one's daily living routine, whether that be self-care, medication management, mobility, and all the things in between. And OT really brings to life the idea of looking at an activity, analyzing the deficits, and bringing to the table interventions and restoration and education. The occupational therapists are assessing the patient for the ability to safely and consistently perform daily living activities. That might be anything from personal hygiene and bathing to one's ability to manage medication, organize a shopping trip, or their finances. Whereas physical therapy is addressing the physical and mobility limitations one would have after hospitalization. I love to get the patient invested in their personal care, invested in their health care and their quality of life. And so any opportunity I have to educate the patient and their family is really meaningful for me, because the more one understands, I think the more one is willing to care for themselves.